G'day. I'm doing a video today on injecting myself with vitamin B12, and the reason I'm doing that is because I find I function a whole lot better when I have vitamin B12 as a supplement. I don't take any other vitamins whatsoever, and I also don't take vitamin B12 as a tablet form. I just inject it quite simply into the muscle there. I find that I don't absorb vitamin B12 as easily from the stomach, and there may be a bunch of reasons for that. I probably perhaps lack the intrinsic factor, what they call the intrinsic factor, which is in the stomach, which absorbs the vitamin B12 from the diet. Anyway, for whatever the reason, I find that I don't absorb it so well from the vitamin B12 tablet, so I'm going to be having it as an injection into my arm. I'm making the video because some people might be interested in what vitamin B12 is good for, what vitamin B12 deficiencies may cause, and the whole process around having vitamin B12. So, without further ado, I've been down to the chemist today, and I've got myself some vitamin B12 ampules there. It's hydrocobalamin, 1 milligram. You can also get methocobalamin, again 1 milligram. I personally just have one a month, one ampule a month, so 1 milligram a month. People who are very highly active, a lot of stress in their diet, a lot of stress in their life, etc., may find that they want to have a little bit more. But usually, for most people, one every 3 months is okay. I have a little bit more. I have one every once a month. I bought myself, the needle and the syringe. I don't know what you call it. Actually, I don't know what they're. The plunger and the syringe there. I bought those. I'm going to connect them together, suck up some vitamin B12, and I'll give you the injection for you to see in a very short while. But the reason I find I function better with vitamin B12 is because when I have vitamin B12 as a supplement, I experience a lot better energy, I sleep better, my moods are a lot better, and a lot of people who are highly active, do a lot of sports, etc., can suffer from vitamin B12 deficiency because they use through it so readily. The more active people are, generally the more vitamin B12 they usually have. Symptoms of a lack of vitamin B12 can be things such as fatigue, poor energy, lack of concentration, memory loss. You can have things such as depression, poor moods, all the way through to full-blown clinical depression. It depends on how lacking you are in vitamin B12 is how bad the symptoms are. But when people are lacking a lot of vitamin B12, like they're not absorbing it too well because they lack the intrinsic factor into their stomach, or they're not getting it in their diet, then they can go all the way through to psychiatric problems, psychological problems rather, and all the way through to they can get pernicious anemia. Now, after 3 years without any treatment, pernicious anemia can cause death. So, pretty serious stuff. So, the great news is, though, that it can be fixed very easily and very quickly by having some vitamin B12 in the diet. So, most people believe that they receive enough vitamin B12 from their diet, and for many people that's true. That you get enough vitamin B12 in the diet, like many cereals and juices and all sorts of things are fortified very heavily with vitamin B12 today, simply because the vitamin B12 in foods these days is destroyed a lot with modern processing, over-fertilization, modern farming methods, etc. And, in addition, people aren't absorbing vitamin B12 from their diet too well because of their lifestyle factors of having perhaps eaten too much garbage processed food, chemicals, agrochemicals, etc. that they're consuming that destroy the intrinsic factors within the stomach that allow you to absorb vitamin B12 from your diet. So the long and the short of it is that about 40% of people, of the general population, are usually a little bit deficient, all the way through to highly deficient in the absorption of vitamin B12. And it can be a big problem. As I said, there's a lot of symptoms there that are unpleasant and can be quite harmful. So it's not just, look, I'm a vegan myself. I don't eat any animal products, and so therefore I don't get vitamin B12 from animal products. Doesn't mean that you can't get vitamin B12 as a vegan. You'd want to be eating things like organic fruits and vegetables though, because modern agriculture with their agrochemicals and in fertilizers and pesticides and herbicides, etc., it destroys the fungus and the bacteria, etc., that sit on the outside of the vegetable roots, in the dirt, and on the outside of fruits, etc., that you would normally absorb your vitamin B12 from. We wash vegetables within an inch of their life these days with modern farm practice. Like, for instance, a potato. You get a potato now, unless you get one unwashed, the washed variety are, clean as a baby's bottom. There's nothing, there's no dirt left on it, there's no natural bacteria left on the outside of that. They're using chemical washes and that sort of thing to get rid of that. So, it's very hard for people to get that from their diet these days unless you're eating good, clean, healthy, organic vegetables and fruits. So, therefore I supplement. I believe that certainly I lack vitamin B12, the ability from my diet, and whether that's because I'm not absorbing it from my intrinsic factors in the stomach there, or as another reason, it doesn't really matter. As I said, about 40% of the population lack the ability to absorb vitamin B12 from their diet. So vitamin B12 is something that's worth having a look at for a lot of people. There's a great book out there called Could It Be B12? And I highly recommend that. That's worth reading, because it'll give you a little bit more insight into what vitamin B12 deficiencies can cause and who may be needing to have vitamin B12 in their diet, or at least as a supplement. So I think I've talked enough about vitamin B12. Let's just give the injection, right? So it's quite simple. Just pull up the sleeve and get ready. I'm going to put my syringe and the plunger together and get them ready. All I quite simply do, don't touch the end of that or get that dirty with anything. Just keep that away from anything. And I'll get my syringe, the needle rather. I think that's the syringe, that's the needle, yeah. So just put the two of them together, quite simply. Join it up nice and hard so they don't come apart. And just ease that out. Now I'm not going to take it all the way out, because as soon as I take it out, it can touch things and get dirty. So just going to leave it sitting gently there while I get the ampule of vitamin B12 ready. I'm just going to flick it down so there's no vitamin B12 in the top there. It's all in the bottom. And quite simply what I do is just break the top of that off, like so. Break the glass. I'll take that out now and just put that in the top of the ampule there. I'm just going to draw the vitamin B12 out into the syringe there. Make sure I get all of it. Now there's going to be a lot of air in there. I've sucked up a lot of air with that. That's okay. You don't want to put any air into your muscle though when you inject this. You can inject this into your butt, or you can inject it into your arm. But either way, you're doing an intramuscular injection and you don't want any air bubbles in there. It can cause a little bit of pain. So just flick any air bubbles that might be stuck to the syringe sides. Just flick that syringe there and that should make those go to the top, which is great. Now, you can do this outside. Squeeze that until it goes to the top. We want to get all that air out of the top there, so I'm going to squeeze the syringe all the way up. But there's a little bit of liquid, just if you can see there in the top there, it's going to squirt everywhere. I don't want to squirt that around my house, so you can do that outside, or you can do it over a sink, something. Just for the purpose of this video, I'm just going to use the paper bag that it came in from the chemist. I'm just going to pop that over the top. I'm not going to touch the syringe onto the inside. I don't want any germs or anything like that onto the end of that, so I'm just going to make sure it doesn't touch. I'm just going to squeeze that up until I get some liquid come out. There's a small air bubble there, it's still there, so I'm just going to flick that up to the top and just squeeze that out. Okay, so you just find a nice big piece of muscle there. You want to squeeze, put the syringe in at least 1 centimetre in. You can go all the way, that's okay. Just piece of muscle and inject it in. Boy, it's hard there. Hang on. Didn't get it in. Try another spot. There we go. All the way in. Okay, just push the syringe all the way down. Nice and gently does it. And once it's done, dry that out. Give it a little rub. I want to safely house the syringe in there, make sure it doesn't poke into anything. And I'll dispose of that properly after the video. There you go, that's injecting yourself with vitamin B12. And I hope you got something out of this video. And look forward to hearing your comments below. Take care.